The following special presentation of your Hometown Health Connection Community Conversations, Heal, Talk, Act, is presented by Buffalo Healthy Living Magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, Best Self Behavioral Health, and WBBZ-TV. Hello, I'm John Di Sciullo. With so much turmoil in the nation today, one topic that is always top of the mind is healthcare. From the plans in place to pay for it, to the type of care you receive, and if we've learned anything in these last few years, it's that good health for you, your family, friends, and loved ones is so vitally important. But how does the healthcare in our region stack up against the rest of the country? You'll be happy to know it ranks very high, with top institutions, healthcare facilities, and dedicated men and women who work hard for us every day. Now, one of those people is Aimana ElBahtity, Executive Director of the Medical Society of the County of Erie, a Buffalo native who earned her law degree at the University of Buffalo School of Law. Aimana shares a background that is similar to many of our own. Her parents were immigrants who came to settle in Western New York in search of a better life for their family, who persevered and became successful. Her dad became a clinical pharmacist, and her mom, who was always there for the family. Aimana's brother is a neurologist, and she has two sisters, one of whom is an attorney and another is a teacher. So welcome to the program, Aimana. What a great background that you've got.
Thank you.
We have some very focused questions. I want to get to the first one very quick at the top. Let's start the conversation by telling our viewers a bit more about you, why you came to Buffalo after having a journey out of state, why you came to Buffalo to become the Executive Director of the Medical Society of the County of Erie.
Okay, thank you very much for that. So I actually did attend UB Law School some 20 years ago, and I was one of those individuals who told their folks, you know, I'm moving out of the region, I want to try to explore different markets. So I did practice in downstate New York region for some time, and then I was in Chicago for some 7 years at an insurance defense firm, always thematically in healthcare. And then I was most recently in the DC area for about the last 8 years. I just moved back in July of 2020 to take on this role, which I ultimately feel like is a culmination of my background, whether it be in risk management, healthcare, advocacy. So I feel blessed to be in this scope. Well, and just in the short time we've had to chat before recording the program, you are a focused individual and a woman of great strength. And you're following in the footsteps of, we were just talking about Dr. Nancy Nielsen and a few others, you know, some very successful women who have preceded you. Oh, well, yes, and thank you. And, you know, it is a huge, you know, compliment to actually even reference me in the same breath as Nancy Nielsen. I'm actually an attorney with an insurance defense, healthcare defense, risk management background. Dr. Nancy Nielsen is the first female physician president of the Erie County Medical Society and only the second female physician president of the American Medical Association, and one of, I think, many of the remarkable doctors in our region who demonstrate why Buffalo really does have remarkable talent in the healthcare arena. And you being an attorney, I find that interesting because you're an attorney, but you're in charge of a medical society. And some of the things you bring to the table are very important for these medical physicians and medical experts because you help guide them through so many legal challenges. Oh, absolutely. And if anything has, you know, the pandemic has shown us, it's that, you know, really, and this is what I do tell our doctors, if you're not at the table, then you're on the menu. And every doctor I have essentially heard from in terms of our membership, after an executive order has come down or some kind of regulation bearing on their clinical operations, where they would say, this isn't even operationally sound. This doesn't even seem like it was drafted by someone with a clinically acute background. And it's because It wasn't. And this is exactly what I tell our doctors. You know, why would you be so academically talented to get into med school, residency, fellowship, and then let someone from another profession, oftentimes an attorney, shape the fate of your profession? Right. So what I do is leverage my legal background to let our doctors know about concerning legislation that may be coming down the pike, or about legislation that ought to be enacted, so that they can enhance their standing, but ultimately so that we can hit it on all marks, incentivize young talent to remain in the region, overcome our access to care issues, and overcome delays in care, which ultimately enhances patient outcomes.
A lot of attention to detail. I understand you're a bit of a historian, which we'll get to in a little bit with the book that you've written, but you know, the difference between 1821 when the society was founded until where we are today, it was so vastly different. Yet I would think the same founding principles still apply to some level. Right?
And they do. And so in 1821, and I co-wrote that book, I definitely have to give great emphasis to Dr. Stacy Watt, very talented anesthesiologist who's also program director at UB Med School. She actually wrote all of the opening chapters. I wrote the captions for each of the images. And so basically it's a glorified picture book, right? There's about 130 images, and it takes the reader through all of the doctors who made up this remarkable fabric of medicine throughout the last 200 years. In 1821, when it was founded by a gentleman named Cyrenius Chapin, he was actually the first documented physician in the region. It was really ultimately formed in order to come to a meeting of the minds among all clinicians in the region so that they could streamline care, which ultimately you would think would enhance patient outcomes, right? That is still the case today. However, our mission, I believe, has pivoted in some way to also make it patient-focused so that we can establish this nexus that if you are doing it right, and if you are a meaningful organization that is trying to streamline care, you are going to ultimately enhance patient outcomes. You are ultimately going to resolve our critical access to care issues that unfortunately we're faced with today.
Yeah, every day there's medical stories. Let's talk about conversations, because one of the most important aspects of our community conversations are about the importance of engaging our general community, who we talk to all the time, in the things that we talk about to help and let their voices be heard. And I know that in the medical society and the work that it does, indirectly or directly engaging our community, you're being a voice for those to help sponsor and pass laws, work with our elected officials, and doing that for the betterment of our community. And you have an interesting story to tell about how one of those Zoom connections resulted in some political movement that has helped our area.
Yes, and it's exciting. So what you're referencing is Advocacy Day, and that occurred on April 8th of 2022. Every year that occurs, where it's literally just 10 face-to-face virtual meetings, which is what we had done with our local legislators that are at the state level. And we basically tell our doctors, our members, right? If you have any free time, just jump in, jump out. There will be this legislator at this time, and they represent this jurisdiction in the event that this is actually your own local legislator from where you reside. And you will have the opportunity to sit front and center and to express concerns you have about either pending legislation or the need for enactment of legislation to enhance healthcare in our region. I will say that on that day, April 8th, we had the pleasure of discussing a very critical act, which is called the Gold Card Act. It was enacted in Texas last year. It has had a critical impact on enhancing patient outcomes because it basically tells insurance companies that if you have approved a procedure 90% or more of the time after requesting for prior authorization, then essentially too bad, so sad. You can no longer request for prior auth for a distinct period of time, and then there's a reevaluation period. But the reason why that's so important is because it overcomes the delays in care that we often see with these undue prior authorization hassles. And think about that breast cancer patient who needs to get that PET scan, right? And the fact that they have to wait for it to be blessed by a claims adjuster, or if it's denied, that they have to go through an appeals process, when time is of the essence, especially when you're in that kind of critical situation. So this notion that we and I mean we as in Western New York doctors, have a very inspiring story to tell, because on that day, on April 8th, 2022, we knew that that legislation was already sponsored by a senior Democrat named Senator Breslin. And what we really wanted to do, especially during these unfortunately politically polarized times, is to make it a bipartisan bill. And after that advocacy day, later that afternoon, we heard from Senator Gallivan, Republican, that due to the conversations he heard and the feedback from our doctors, he decided to co-sponsor the bill, making it a bipartisan bill. So it was Western New York doctors, their momentum, their pull, their organization, right, their streamlined approach, that compelled a legislator to say, you know what, at the end of the day, we're all patients, and let's, do what's right for the patient population.
Congratulations. Aimana, look, you're navigating through insurance companies, physicians, hospitals, institutions, and politicians. Your to-do list is 10 times bigger than mine, I'm going to tell you that.
Well, I wouldn't say that, but I will tell you that, momentum begets momentum.
Okay.
And we have been able to demonstrate that in numbers. Trade organizations throughout the country, had become less relevant through the times. During the Nancy Nielsen days, right, it was the thing to do, be part of organized medicine. It has now, it's almost like the pandemic put this new breath into it. It's almost as if folks started to see the real relevance behind streamlining and becoming organized and having a meeting of the minds so that you can demonstrate power in numbers. And that's what the Erie County Med Society has been able to do. Instead of shrinking, we've been able to demonstrate that we are growing exponentially every year.
And helping cutting that red tape. Let's talk about the Grievance Family Act. What is that?
Okay, so that's another bill. I told you about the Gold Card Act, which is very exciting, and we've now been able to make that a bipartisan bill, even got attention from the American Medical Association. But unfortunately, the Grievance Family Act, and this is where I feel like an attorney, someone in my seat, can actually play a very helpful role in having our doctors understand the true implications behind what may very well be a misnomer that sounds like a positive thing for patients at large, but all it will stand to do, based on real actuarial data, is raise the medical malpractice premiums for our practicing doctors in the state of New York by some 40%, which ultimately, and I'm going to state a fact, is going to compound our access to care issues even more, because it's going to likely drive clinicians out of the region. Let me just give you a semblance of what 40% more in a premium means. If you're an OB-GYN, if you're an OB gynecologist, you stand to pay an additional $79,000 more a year just to practice in the state of New York if this bill gets passed as written. So it's very concerning, because the last thing we need, and what we have really seen become amplified during the pandemic, is that there were some instances where our patients in Western New York were parking it in an emergency room for some 20 hours waiting to see a clinician. And when you see that direct correlation of delays in care and adverse patient outcomes, it's honestly really concerning and unfortunate that this is a bill that could potentially get passed.
Wow. We were talking earlier about in the 80s, it seemed like, at least to me, medical malpractice was much more in focus, much more in the headlines. I know it still exists out there, and you just mentioned a fee for a doctor. Is it still as big a deal for medical providers that they have that insurance they have to take, and then they're potentially going to be on the back end of a lawsuit somehow, some way?
Oh yes, and especially for medical providers in the state of New York, which is all the more reason why the AMA has actually conducted studies and found that New York is the least favorable place to practice medicine for these very reasons. In fact, payouts to plaintiffs in medical malpractice actions is highest in the state of New York, which is almost triple the second state throughout the nation, which is Pennsylvania. It's very concerning. So when you are a doctor and you already feel like you are in a position of having to almost check yourself before you can just follow your gut and your talent and your intuition because of what may come down the pike, that actually is not a service for the patient population.
Because they start second guessing what to do for fear of what litigious issue might happen.
And what I can tell you is that, you know, this is where I've been able to leverage my background. So my most recent role was serving as a risk director, a patient safety officer at a large hospital in the DC metro area. I was literally the individual that was called to the table whenever anything went left. All right. If there was a surgery and then there was an adverse outcome, oh no, you know, because I would have to try to identify ways to proactively mitigate exposure, see what we have to do in terms of our insurance coverage, and make sure that we had a meeting of the minds in terms of what's called a root cause analysis so that we could get ahead of these outcomes and proactively understand, okay, how can we make it so that this unanticipated outcome does not happen again?
You talked about organized medicine. What is organized medicine? Is it what we think of like the Catholic health system, Kaleida Health? Explain that concept.
Sure, organized medicine, if you will, and maybe it's easier for folks to understand when they think of the American Medical Association, okay? It's an opportunity for folks from the same profession, so we're talking about MDs and DOs, to come together to have a meeting of the minds about issues that bear on their profession, but then to ultimately become powerful, right, in growing numbers. And what that ultimately does for the patient population is it streamlines outcomes, it enhances outcomes, because you're going to have less deviations when you have a meeting of the minds of folks from the same profession about what is best for their clientele or for their patients. I will tell you right now, we have a practice management committee that meets virtually. And it was basically an all call to practice administrators among our membership, right? So not even doctors, they're practice administrators, they're CFOs, they're COOs, they're billing managers. And basically, through our email blast that we issue almost daily, we reached out and said, calling all practice administrators, if your doctor is a member of the Med Society, you are invited to come on the third Thursday of every month to our meeting, and we can all come together to identify the most common pain points and the most best practices to overcome those pain points. And what have you done even culturally? You have taken people who are conventionally competitors and they're now all leaning on each other. They're showing up to these virtual meetings to be like, well, yeah, and I'm noticing that this is an issue, but this is actually what I did to address it. And when you see that, it's very inspiring. It almost plays a role in the culture of Western New York, which I find very remarkable and inspiring. And that's why I have to actually say, I can't unilaterally take credit for this momentum we're seeing with the Med Society. It's the culture of Western New York doctors. It's the culture of Western New York stakeholders just wanting to be all hands on deck and working together.
Well, with your leadership, is that one of the reasons I would suspect, with all that collaborative thinking, one of the reasons the Medical Society is so successful?
Yes, absolutely. I'm going to be very frank. I mean, with any membership organization, you have to establish, okay, there's a due that's associated with that membership. If you can establish that membership pays, it does not cost, you win every single time. So look at some of the member benefits. They get free legal consultative services. And anyone who knows me knows I hand out my cell phone to all of our docs. And I understand that they have their full-time jobs. So they have to reach out to me at night or on the weekends. And that is completely fine. That's very similar to the kind of scopes I've had in my prior roles where they were pretty demanding. But when you think that at your fingertips you have also that guidance, not just from a legal or a risk management standpoint, which I always say is consultative, and I always say lean on your general counsel because I don't want to step on anyone's toes, but think about this, for example. I'm a certified contract administrator. One of the other benefits, I'll look at your employment contract and I'll tell you if there's a restrictive covenant that's really concerning. So why wouldn't you want somebody who's considered a subject matter expert in these kinds of things to lay eyes on things to make sure that they are giving you, the best guidance to position you professionally going forward. But then, of course, we also offer free CMEs, a physician locator, which helps with marketing.
Yeah, I was going to talk about that because you talked a lot now about what the society does for the physician and the medical expert, let's flip over to the patient side of it, where they go to wnydocs.org and they see the patient, the doctor's locator. What is that?
Okay, so when I came from the DC area, again, I came during the thick of the pandemic. So I'm a patient too. I had to find a primary care doctor. And when I found that it took some 4 months before I could even get in to see a doctor, we decided that we would create an electronic listing of which is searchable, of a physician locator, where we ask our members, look, if you are willing and pledging to accept new patients, we will put you on this physician locator. So think about how this helps our doctors, because now this is going to help them from obviously a patient referral standpoint. But for our patients, they can now, if you need to look for a family doctor, okay, so like an internist or an ENT doctor or a cardiologist, any kind of specialty, all you have to do is go into wnydocs.org, click on Physician Locator, which is at the top left, and you can actually search, and it'll drill down based on location, practice area. So you're picking a doctor who's already pledged to accept new patients. You're not wasting your time, and they are revealing exactly where they're situated, so you can pick one closest to your home.
Well, that's good, because for people like me, and the viewers know, I need it to be as simple as it can possibly be, and that's good that it is that. Let's talk about, you mentioned UB, and let's talk about the collaboration between the society and UB, because I know you're working with the med school there, and Allison Bashir, the doctor over there.
Yes, the new dean, very impressive. A person who every chance I get, say thank you for choosing Buffalo. Dean Bashir just came, she's a world-renowned neurologist. She just came from UC Davis in December of last year, and she heads our med school. And it's fantastic because we're getting someone who literally, her research formed the basis of 3 FDA-approved drugs, which is just so remarkable. But she really just has this, I feel like, vision, innovation to her that is going to bring us forward. And what she's agreed to do is allow us access to her med students, where we provide membership to the med student population for free. And here's why we do it. Because we're trying to create a meaningful physician mentorship program. So we have all of these seasoned doctors who, unfortunately, due to the pains of the pandemic, have opted to retire some 10 years early, right? So we have all these seasoned professionals in our pipeline at the Medical Society as physician members. And now we're going to be able to align young talent or new doctors with those seasoned professionals before they bow out, which will enhance the quality of patient care, because you're basically leaning on the most experienced person, right, in their scope. But then also you're incentivizing, hopefully, that young talent to remain in the region upon graduation. Right. Because if you have that networking opportunity and you have that mentorship, they're not
going to go to Philadelphia or Chicago or Washington.
Exactly. Well,
yeah, and I mean, they might, but we want them to stay here.
Right.
We only have about 5 minutes left, Aimana. I want to touch on the misinformation we all heard about during COVID and some of the things that happened during the pandemic. It was just a cacophony of so many things. How do you advise the viewer watching to make sure they get the right information from their physician or whoever they get it from?
Right, and that's a fair question. And ultimately, at the end of the day, it has to be your own personal decision, right? But what we did during the pandemic was created this COVID-19 work group, where we decided the best thing to do, which is another inspiring story, because these were people who are conventional competitors, senior stakeholders, not just Gail Burstein, who is our health commissioner and also on the board of the Med Society, who I have the pleasure of working closely with, but then also senior stakeholders at all the different regional health systems, right? Coming together, having a meeting of the minds on best practices, on what patients should be counseled on with respect to what was evolving, and then issuing consensus statements. Because there is a peace of mind that should come to a patient population if they're feeling like, well, you know what, I'm not just getting this source from one area. These are senior subject matter experts who have now come to a meeting of the minds and are providing these recommendations.
Yeah, and stay away from sketchy social media, that.
Yeah, and honestly, yes, and that is, the unfortunate thing that we have to contend with today. But if you give folks the tools to make the right decisions, and I think consensus statements is where it's at.
Yeah.
I think when you make folks realize that you are putting together all of these subject matter experts, buy-in before making a recommendation, I think that should give some ease to the patient population, that they can rest on their judgment.
A few more minutes left. I want to go back to this book. Tell me about the book, the name of the book, why you put it together, and where people can find it.
And thank you for that question, because I actually think that there's something that is inspiring and exciting that we should highlight from the book, because history does indeed repeat itself, okay? In 1900, the book reveals that we had a health commissioner named Ernest Wind, okay? He discovered the source of the typhoid pandemic, and he made it so that Buffalo had the lowest death rate of any city of its size in the world at that time. And the reason why that is so remarkable is because historically, that was during the Pan American Exposition, when we were basically the queen city of the entire country. So what do you see? You see a thematic correlation that when you're thriving in healthcare, you are a bustling city. And that's where I draw a lot of the inspiration of my current role, because I feel like there's something tangible we could do to enhance Buffalo by making sure that we highlight that there are certain attributes of what makes a region successful. And if we are all hands on deck and we collaborate together, which we are doing, we can actually make a tangible impact to enhance the fate of our city.
What's the name of the book again? The
Medical Society of Erie County, and you can get it at wnydocs.org. It's an Arcadia publishing book. It's an easy read. I'd classify it as perhaps a picture book that you skim through at a coffee shop, but it's loaded with a lot of information and a lot of inspiring doctors who really made up the fabric of medicine in our region.
Yeah, you mentioned before you didn't realize Roswell Park was really a guy, Roswell Park.
How embarrassing, right? So this was good for me too, because it was a crash course on, I ought to know who the doctors were who made up the fabric of our region.
Well, I didn't know either till I came to Buffalo either. So, Aimana, you are just a wealth of passion and dedication to our community, and we're so blessed to have you here to help all of our medical experts and help our patient population as well.
And likewise, and I feel so blessed to be back in the region. Buffalo has such inspiring momentum, and if I could play some small role in continuing that momentum, I do feel truly blessed.
Well, it's a big role, that's for sure. Well, that's all the time we have for our community conversation. We want to thank our attorney, more than an attorney, you're an inspiration, Aimana ElBahtity, Executive Director of the Medical Society of the County of Erie. Now, we have a website, that important one to write down if you want to know not only about the book, but the work of the Society. The website is wnydocs.org. That's wnydocs.org. And we're going to be continuing these important community conversations on WBBZ, produced in partnership with Annette Pinder and the Buffalo Healthy Living magazine, because we want you to be inspired to make change and have those conversations with one another. And thanks for watching. Be safe and be well. This special edition of your hometown Health Connection Community Conversations, Heal, Talk, Act, was presented by Buffalo Healthy Living magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, Best Self Behavioral Health, and WBBZ-TV.